There are viruses in bats that infect bats all the time. When they emerge into people, can make us very sick. And the viruses we know of that are closest to the COVID-19 virus is a virus that is one of the viruses that circulates in bats.
That was Dr. Stephen Goldstein, a University of Utah researcher of viruses, talking about the data he can collect during the pandemic. Welcome to our In Focus discussion tonight about innovations during the pandemic. It's hard to take a larger view of the pandemic while we are still in the middle of it. But there is an immense amount of data being generated because of COVID-19. And while we tend to focus on the day-to-day implications of what we learn, there are larger concepts and scientific experiments that we are going to be able to figure out at some point. So what are some of the big innovations in science and public health that we are learning? Joining us now via Zoom is Dr. Nels Elde, Associate Professor of Human Genetics at the University of Utah. Dr. Elde, thanks for joining us tonight. It's great to see you.
Thanks for having me on tonight. I appreciate it.
Doctor, you mentioned in an academic paper during a podcast you host that talked about the evolution of the coronavirus. What can you tell us generally about this paper that came out of NC State?
Yeah, so we think a lot every day in the headlines. We think about the variants of interest, variants of concern. These are changes in the virus that are happening in real time as the pandemic progresses. But this emerging work actually rewinds the tape to think about, well, how did this virus get to us in the first place? From a genetic standpoint, what are the changes that might have allowed the virus to spill over, presumably from something like a bat population into humans about a year ago now, or a year and a half?
And like all science, especially at this stage where there is only one paper out on it, there isn't an absolute answer. But if it is correct, the difference in the DNA between two viruses is the link between not being a human contagion and causing a pandemic. What exactly does that mean?
Yeah, so, the way we think about the evolution of a virus does involve these changes in the genetic code, in this case, the RNA. And so what the work tries to do is to ask what was different about all of the viruses very closely related to SARS-CoV-2 versus the virus that we're working against today. And so this identifies one of those potential changes that might have been really key in that process of spilling over. It's probably not the only change in there, and there's still a lot of work to do, as you're saying, but a really interesting lead that might give us some clues about how viruses might change to come into human populations in the future as well.
In your opinion, what are the big ideas that may come out of the pandemic? What are the big questions that you think need to be answered?
Yeah, so, of course, the really pressing issues are these variants of concern? Are they going to evade our vaccines and things like that? I think you'll talk about that maybe a little bit more with the next guest. But what we're thinking about as evolutionary geneticists, evolutionary biologists, is if we turn back the clock to see what happened of how the virus emerged in the first place, will that give us some ideas about what might happen in the future? Can we forecast new pandemics or future pandemics and be better prepared in those cases? I think that's a big question. Can we forecast and understand what might happen next?
I hope the answer to that is a big resounding yes, because I don't know. I think all of us can agree that we don't want to go through something of this scope and magnitude again. So hopefully there's a yes to that question in the future. Now, Dr. Elde, we know you've been working on a lot of stuff. What are you working on now?
Yeah, so in addition to thinking about these kind of ideas, we also think about, how the virus changes, not in just little small steps. Some of these variants of concern involve single letter changes in the genetic code. We're thinking about how these viruses recombined, how they in one leap can take on hundreds of changes potentially, or many changes at once, and the impact of this. So does that, what might that look like in a future pandemic? Or again, can we predict how these changes, might tell us about what are the other viruses out there, like SARS-2? So when we go from SARS-1 to SARS-2, can we be kind of on our toes to avoid a big impact from potentially something like SARS-3?
On that note, let's talk about the pandemic as a fire hose of data. What are the challenges of parsing through all of it while we are still living in it?
Yeah, so it's really incredible, just the timing of this with the genomic technologies. We can read the code of all these viruses from patients as they almost by the day. And so we now have available to us almost 200,000 sequences of the virus to really at high resolution watch it change. And so that's a fire hose. And so the challenge is, How do we figure out what is the key information there from the deluge of information? And so that's some of the work that we and a lot of others are doing right now in real time.
And we commend you as our medical experts or scientists for doing the work for us, because everyone's hungry for answers, but they need to realize like it takes work, right, to get through those questions and get to the answers. Dr. Elde, we have about 30 seconds left. I'd like to give you the final word. Is there anything else that you'd like to include in this discussion that we haven't addressed yet?
Yeah, so what should we be doing now? We heard just in the news stories earlier on this newscast, where some states are starting to relax some of the precautions. I think that's a mistake. We need to hang in there. We're really close. The vaccines are looking incredible in a lot of cases. If we keep wearing masks, if we keep up what we've been doing recently, the direction is really favorable. And so even some of those variants, some of that evolution happening in real time, probably not an issue if we have that fortitude to stay the course here and continue to do the public health measures that will help us take the next steps in getting beyond this pandemic.
A very good reminder. Folks, you've been hearing from Dr. Nels Elde, Associate Professor of Human Genetics at the University of Utah. Dr. Elde, thanks for making the time to join us tonight. We enjoyed hearing from you.
Thanks so much. Appreciate it.
You have 85% protection against severe COVID, irrespective of where in the world you're talking about and what kind of variant you're talking about.
That was Dr. Ma-Tai Mayman of Johnson & Johnson talking about how effective their single shot of vaccine is. Innovations emerging everywhere in COVID-19 vaccine creation and distribution, some big and some small. Thanks for staying with us for our second In Focus discussion tonight on innovations during the pandemic. Joining us now live via Zoom is Dr. Sankar Swaminathan, Chief of Infectious Diseases at the University of Utah Hospital. Doc, thanks for being here and welcome to the show.
Thank you for having me.
So the big idea so far from the pandemic in relation to the vaccines was using mRNA techniques. It really sped up the process to get the vaccine into arms in about a year. Can you tell us more about this?
You know, I think one of the first steps that really made this possible so quickly was the fact that we were able to get the genetic sequence of the virus out into the public domain, you know, almost immediately after the disease occurred. And that is because of the tremendous strides that have occurred in genetic sequencing over the past 20, 30 years. And after that, it's not just the mRNA vaccines, but we have the Johnson & Johnson vaccine, which is a DNA vaccine, and there are other vaccines that were made by more traditional methods that are in use in other parts of the world. So I think it really speaks to what can happen when government and private industry and scientists all work together. So it really is a tremendous achievement. And you know, the scientists who've been working on these mRNA techniques have been doing this for a long time. They've been making and testing vaccines in animals for years now. So that's another thing that sort of laid the groundwork for this rapid development of the coronavirus vaccines.
Doctor, what is being investigated or studied when it comes to variants or perhaps even future strains of COVID-19?
So I think one thing that's happening now that is really good that we needed to do is that in the United States, we're having rapid sequencing in a very proactive fashion. So the various laboratories around the country, the CDC, and so on are not only collecting the sequence data, but compiling it and collaborating so that we can have our eye out, know when these variants are starting to crop up, because this isn't just some Andromeda strain that's coming from South Africa. These variant strains are arising potentially every day where there's a lot of transmission in the US and elsewhere.
When you look at the creation of the vaccine, what are you seeing from all the data that may be the next leap forward in vaccines? What is the next big idea?
Well, I'm not sure what the next big idea is, because there's probably someone smarter than eye who is having that idea right now. But I think one of the really exciting things about not only the mRNA vaccine, but really some of these other platforms is that we might be able to stay one step ahead of the race with the virus, because making these mRNA vaccines theoretically is as simple as typing in the new genetic code of the new variant or mutant. And, I think those vaccines can be made in the laboratory within a matter of days and be put into production within a matter of months, so that we would be able to pivot to be able to cover additional variants or escape mutants. And I think that's really tremendously exciting, not just for COVID-19, but potentially for every other infection that we vaccinate against.
How do you balance the fire hose of data during this real-world pandemic, dealing with the daily issues, and still thinking about the bigger questions?
Yeah, so, and I'm not trying to be facetious here, but the way I deal with it is that I don't pay attention to things as they come out immediately. I can wait a day or two and take my time and read it properly, and then I'll only be wrong once a week instead of being wrong every day.
That's a great approach, actually. Doc, final thoughts. Anything else that you want to include in this conversation that we haven't discussed yet?
Yeah, so, for years and years, people who study flu have been warning us about something like this. And they've been warning the government that we need more public health money, that we need more money for the CDC, that we need more money for research in virology and other diseases. And, nobody thinks about fire prevention until their house is on fire. And they thought it was going to be avian flu, but it turned out to be this, okay? Next year, it could be another coronavirus. And as Dr. Elde was talking about, there are hundreds, if not thousands, of viruses in bat populations. But it's not just in bat populations. There are emerging infectious diseases probably everywhere you look. And I think that staying vigilant is not just wearing your mask and getting vaccinated, but making sure that we look ahead and try to find, prevent, and understand these emerging infectious diseases, because there's going to be another one.
Well said. Let's be proactive instead of reactive. All right, you've been hearing from Dr. Sankar Swaminathan, Chief of Infectious Diseases at the University of Utah Hospital. Doc, thanks for being on the show tonight and sharing all of your expertise with us. We enjoyed you.
Thank you.
It is an incentive to do what we've been saying all along, to vaccinate as many people as we can, as quickly as we possibly can.
That was Dr. Anthony Fauci in January, talking about the public health component of the pandemic. We know that creating the vaccine is not enough. We also have to be able to get it out to the public. Welcome to our third and final In Focus discussion tonight on innovation during the pandemic. So how do you mobilize and get vaccines out to everyone? Well, one thing we do know is that there's a lot of planning involved. Joining us now is Ivy Melton-Sells, the Community Health Services Division Director for the Davis County Health Department. Ivy, thanks for joining us tonight and spending your Friday night with us.
Thank you so much for having me. I'm glad to be here.
Ivy, let's first talk about the emergency health scenario planning. Your department has done a lot of it. When did it start, and what kind of things did you plan for?
We respond to a lot of different public health emergencies. Our environmental health scientists have been involved in emergency response for several decades. For example, things like a diesel spill. Since that time, starting in about the time of 9/11 and the anthrax attacks that happened just after that, we have been focused on what we can do to do exactly what we're doing right now. How do we get antibiotics or vaccines to the entire population in a short period of time?
Now, smallpox and influenza outbreaks were also scenarios that your department has planned for. What were in those plans, and how accurately did they reflect what is going on right now?
The smallpox and influenza pans are some of the first ones that we worked on, and the focus with those was a little different than what we're doing right now. In that smallpox, you want to get a vaccine to everybody who was exposed within a 3-day period. So we've been planning for some time on how to do this very quickly to large amounts of the population. Influenza, a little bit different. Our bottleneck there is how quickly that vaccine comes. So we want to make sure, we have been planning that we are absolutely prepared. The vaccine comes, we get it out as quickly as we can instead of a bottleneck somewhere else in the process.
Were there any innovations that you had to make on the fly, maybe in messaging regarding masks when the science changed, or maybe in distribution of the vaccine?
Early on in our response process, we found that we needed to bring together a communication team in our department that didn't exist before. Because information was changing so rapidly, we had to make sure that all of our staff were prepared with the correct information. As we've moved forward into the vaccination process, we wanted to put together an online scheduling system that didn't exist before. So that was a brand new thing for us up here in Davis County. We also needed to put together, we found out very quickly, a call center. In our original plans, we had planned for something that only had 6 phone lines. And so we had to ramp that up with our different partners here within the county to be able to handle hundreds of calls at a time. And that, again, that was something that was brand new, that was very necessary for us to be effective.
I think it's just so incredible that you all have had to do so much in such little time. Now, I know you covered a lot in that last answer, Ivy. Has any other major innovation taken place during the pandemic that you all are able to apply to what you're doing now?
You know, those are the 2 biggest ones. This scheduling system, we're actually working with our programmers right now that we're going to tweak it a bit so we can use it for flu vaccine campaigns in the future. When we work with different partners, one in particular is Hill Air Force Base, we work with every year vaccinating a lot of their staff up there on base. And then that call center, we're now prepared through something that we had to learn to do very quickly, to ramp up something on our own outside of our other partner agencies should the need ever arise.
And to wrap this all up, after the pandemic is over, how will you and your department go back to study what you did to improve on the next disaster, whether it is another outbreak or even something like an earthquake?
It's a best practice in emergency management to sit down and to review everything that happened and put together what we call an after action report and an improvement plan, what it is that we need to focus on in the next while to address the issues that we found during the response, and then who's responsible for each one of those. We have since the beginning been doing a process evaluation ongoing because this has been such a long response. But we're dedicated, and we're for sure looking forward to the opportunity to change from response mode into more of that recovery, and how do we identify those lessons learned.
Ivy, you as one of our public health officials have been working tirelessly. We commend you so much for the work that you're doing just to better the health, safety, and welfare of our community. Folks, you've been hearing from Ivy Mountain-Sells, the Community Health Services Division Director for the Davis County Health Department. Ivy, we appreciate you spending your Friday night with us. Thanks for being here.
Thank you. Have a wonderful evening.
You too.